The opinions expressed in this video are my own and not those of SMA News Today, its parent company, BioNews, nor any other organization. These videos are intended to spark discussions about issues pertaining to spinal muscular atrophy and are not meant to be professional medical advice. Hey everybody, welcome to another edition of the Morale Monologue. My name is Michael Morale. Okay, so in today's video, I want to talk to you about the pros and cons of having a subcutaneous port implanted in your body. And I've done videos in the past where I talked about why I had a port implanted and the reasons why I went ahead and did it a long time ago versus as we get closer to Scholar Rock getting FDA approval for apitegromab. So I had a port implanted in my body a few years ago whenever Scholar Rock was talking about apitegromab, and they also discussed the potential delivery system for this treatment. Now what I mean by delivery system is it going to be an intrathecal injection that we get when we get our Spinraza, or is it going to be an IV infusion? And they talked about it would be an IV infusion. So when you go to the doctor and you're dehydrated, they'll hook you up to an IV, and it's just saline in a bag that will run through the tube into your body to help you hydrate. Well, apitegromab, as far as we know right now, will be delivered that way. And they were talking about that it was going to be delivered every 4 weeks. So you'll either go to the hospital or to your clinic or to your doctor's office, wherever you get your Spinraza injection, and then they'll be able to hook you up to an IV and give you the apitegromab treatment. So we'll be getting our Spinraza injections every 4 months, and we'll be getting the apitegromab IV infusion every 4 weeks. Now, if you're anything like me, finding a vein to get an IV in is like finding a needle in a haystack. I think the majority of us that have SMA, we have very small veins. They're very deep in our body. They don't, stick out, say, as an able-bodied person's veins would stick out. And mine roll like marbles. So even the best trained phlebotomist will scratch their head and get frustrated because they can't find a vein in me. I went to UT Southwestern Medical Center last Monday, March the 3rd, for my 24th Spinraza injection. The phlebotomist came in to do the blood sample, and she poked me 4 times trying to find a vein. So she finally agreed to use my port. Now, in the past, they won't use the port for just blood draws because anytime that they finish using a port, they have to flush it with saline and then cap it or lock it with heparin. And heparin is an anticoagulant that keeps the catheter going from the port that runs through the vein in my neck. It keeps it from clogging up. Well, there's a nationwide shortage right now of heparin. So since she wasn't going to have to use heparin for me, she agreed to go ahead and do the blood draw. Now, what they did was they use what's called a Huber needle, and the port is implanted just under the skin on the upper side of my chest. And just under the skin, that's where they get the name subcutaneous. So she put the Huber needle through my skin into the port, and then she taped it down where it wouldn't move, similar to what they would do with an IV. And then she hooked up a syringe and withdrew some blood. Now, if you've got heparin in that line, they have to throw away quite a bit of blood before they can get what they consider a clean sample. So anyway, she withdrew about 4 cc's of blood, which really isn't very much. I was surprised that she didn't withdraw more. So after that, she got her blood sample, and then she flushed it twice with saline. Okay? So that's one of the benefits of having a port, is that you're not going to get poked and prodded like a pincushion if they need to find a vein to give you your apitegromab treatment, or if you need an IV for fluids. So But one of the downfalls of having a port is that you have to be trained on how to access the port, meaning how to go about inserting the needle into the skin and through the little plastic layer or rubberized layer of the port. And a lot of nurses are not trained in how to access subcutaneous ports. The port that I've got is called a power port, which means that if I ever needed to go through a CT scan or any kind of scan where they have to use dye, like the radioactive dye, they have to push that rather quickly through your vein for it to work. And a power port will allow them to do that. So that's the reason why I got that. So there's a lot of advantages of having a port. One, you don't come out of the hospital all bruised up because they've had to jab you 30 times to try to find a vein. It's also much quicker, and it's not as painful to me accessing my port than it is for them to, try to poke a needle into the vein, move the needle around, hit the vein, and then sometimes while they're getting the blood, the vein will collapse because my veins are so small. So, one of the things that I would recommend you do is if this sounds like something that you would be interested in, make sure that you talk to your doctors about this. Let them know that you're getting tired of being a phlebotomist pincushion and say, what are the steps that you need to take to get a port put in? The surgery that I went through to get my port lasted about 45 minutes. I went into the hospital in the morning and I was out of the hospital before lunchtime. It was not a painful recovery at all. I was a little bit stiff where they ran the vein into my, or I'm sorry, where they ran the catheter into the vein in my neck. I was a little bit tender there for a week or two, especially if I stretched my neck too much or if I looked up and to my left. I could feel that catheter in the vein. But after a couple of weeks, it went away. I didn't have to take any pain medication. And now, when I go to the hospital, it's so much easier for me. It's easier for the hospital. It's really a much better way of doing things. So, if apitegromab is approved by the FDA, which I believe it will be, uh, the home health care nurse or my doctor won't have to struggle to get an IV in me every 4 weeks. If I had an IV in me every 4 weeks, I would not be I would not be happy. I mean, I would be bruised up and I would not be in a good state of mind. So this port is really going to be helpful. So there are a few disadvantages to having ports. If you don't access the port at least once every 4 weeks, you need to get a home health care nurse to come out and flush the port. Okay, if it's not being used, doesn't mean that you can just ignore it. My home health care nurse, well, that's tough to say. My home health care nurse has to come out, insert a needle into my port, flush it twice with heparin, and then flush it twice with saline, and then she'll cap it with heparin. And I'm good for another 4 weeks. She's at my house maybe 10 minutes, and it's not painful at all. Now, once I start going through the apitegromab IV infusions every 4 weeks, then I won't have to worry about it because I'll go to the doctor, they'll access my port, they'll flush it first to clear the line, they'll hook me up to the IV, and after I finish with the apitegromab IV infusion, then they'll flush the port again and cap it with heparin, and I'll go home. And then in 4 weeks, I'll go back and we'll repeat the process. So even though I've got to get my port flushed now, that's just because we don't access the port for anything other than just simple blood draws. My hospital that I go to, UT Southwestern, didn't want to use my port to get the blood. But now that there's a shortage of heparin, they went ahead and did it. And I think I'm just going to tell them from now on, if you want blood, you're going to have to go through the port. Now, one of the things that I found funny, and I mentioned this earlier, was when the nurse withdrew blood to get rid of the heparin out of my port, I said she only took a small amount. and I was wondering why she didn't take more. Well, one of the blood tests that they do before I get my Spinraza injection is to check the coagulation levels of my blood. And that blood test came back way skewed. I mean, the numbers were off the chart. But the doctor knew that they got the blood from my port and knew that they probably didn't withdraw enough. So from now on, I'm going to make sure that they withdraw at least 10 to 15 cc's of blood. That way, they're assured that they're getting all of the heparin out of that catheter going from the port to the vein in my neck. Now, my home health care nurse withdrew blood about 3 weeks ago for my physical, and she withdrew quite a bit of blood, and she threw that blood away. I don't mean she threw it in the trash, but they don't use that blood. But at least she got enough to get all the heparin out, and then she took her blood sample, and my blood work came back fine. So there are a few disadvantages to having ports, but the pros far outweigh the cons. So please, if you're getting tired of getting poked, this is a problem that we all have, talk to your doctor and tell them what are the advantages of you getting a port. Again, the surgery is a day surgery. Go in the morning, you go home by lunch. There's really no complications to it. Surgery only lasts about 45 minutes. So I think this might be something that would benefit you. So please take time out of your day, talk to your doctor, and find out if a port is right for you. Hey, I hope that this video was useful, and I hope you got some information out of it that you could use. Please do me a favor. Do something for yourself this upcoming week that will make your life just a little bit better. We at SMA News Today hope all of you are doing well, and I'll talk to you in a couple of weeks. Bye-bye.